let's get into that. The preconception cleanse, as you call it. What does that consist of when patients come to you and say, and in this book, what are we doing? What actions are you advising we take?
So there's a couple things that are kind of important that I kind of want this book to be a paradigm shifter so that women start to think about conception long before they conceive, because we have good prenatal care in this country, but when you're pregnant, it's too late to do any of this. So even though you can conceive, and that's a wonderful thing, you don't want to have the downstream possibility of a child on the autism spectrum or with ADD and focus and massive immune challenges. We're seeing kids with massive allergies and autoimmunity at earlier and earlier ages. So usually what we do is I love to have a year prior to conception. So that's why this is an important paradigm shifter, because women think about getting pregnant and then they don't give themselves enough time. So if you know you ever want to have a baby, it's important to at least get some of this information and start thinking about it. Give yourself a year. So this is also, there's a lot of behavioral change that needs to happen with buying organic food and being careful about what you use on your body. And so that takes time. And I always tell women, and men, just give yourself enough time so it doesn't feel unsustainable. So you want to make these gradual changes over time. So we do blood work. We say, most women don't have blood work done until after they're pregnant. But if you do it before, we can determine some genetic potential problems that we can address with food. So MTHFR is one gene. I'm really looking at hypercoagulation right now. Those things can impair, keeping a pregnancy through the first trimester, and that's all modifiable. And then we look at heavy metals depending on what their exposure is like. Vaccines, amalgams in your teeth, a lot of fish consumption, all those things can build up, and we don't want mercury and lead in anything other than, there's very little that's considered safe. It's actually no exposure to those things is safe. So we do a lot of blood testing. And then a thorough history of their family history. So what's your family history? Who died of what? What's your maternal grandparents, your great grandparents? Where did they live? What were they exposed to? Because that gives me a real clue about what this person might be harboring as well. So we talk a lot, we do a lot of labs. And then for the detoxification portion, I really talk to them about the 5 pathways of elimination: liver, kidney, lymph, skin, and bowel. Making sure those are all open, doing some drainage prior to detoxification, making sure you can excrete. So when people don't sweat or they don't poop, we got to open those doorways. Otherwise, you're going to get sicker. So most people, there's a huge amount of denial around toxicity, which is kind of fascinating. So if you live on this earth and you breathe air and drink water and eat food, you have toxicity. So, there's a ton of denial around this. So that will shift too as we face the problem of infertility, which I believe we're looking at the tip of the iceberg right now. And I do think it's going to be a huge problem coming up for the next generation of kids who want to conceive.
Yeah, I completely concur. I actually wrote about this not long ago, that I think one of the biggest threats to our society is, you can look at climate change, you can look at lots of different things, but I think the amount of toxins we're putting out within us that can cause a children of men type of, scenario where people just can't conceive anymore, where it's going to be a smaller and smaller portion to where it's a rare thing that we have children may be possible there.